select group there. I hope nobody joined after we'd both left, but if they did, then please message me on the chat, because we want to try and reach out more to dom care providers and make sure that we're addressing all the different people's needs. And also the supported living. Again, I don't think, did anybody join the supported living, Hayley?
We did.
Oh,
It
okay.
did. I'm really sorry I couldn't work out how to join you. I just sat waiting, so I hope it went okay.
That's kind of ironic that you set it up and then you couldn't work out how to join it, Hayley. Right, so it looks like we've got everybody back now. Just very briefly, John had put something in the chat about being keen to hear how services advertise, what languages are spoken by staff and volunteers in their services, to help with matching staff and service users. Just trying to sort of address and celebrate the diversity in the county. I don't know if anybody has any particular comment on that at the moment.
I know that homes that are on carehome.co.uk can put in on their profile the variety of languages that are spoken in their service, but that's the only one I know of.
Yeah, I mean, I think in terms of diversity, we have some diversity amongst our staff team, but fairly little diversity amongst our client group, I would say. I don't know, Sophie, whether you can. I'm just trying to think of certainly the residents in the care home. They're diverse in different ways, I guess, but in terms of languages spoken, I think everybody in our care home is English as the first language.
Yeah, we have a couple of fluent French speakers, but that's about as exotic as we get.
Yeah. So, John, it's an interesting one. I see Taz has come back to you on the chat, which that's a good idea, putting posters in windows based on language demographics. But in terms of matching, we don't have the clients to match with particularly, I don't think. So moving on with the agenda, we are now welcoming Nada from the Sussex Digital InReach team, one of her different hats, one of her many different hats, which again, another really valuable tool. So over to you, Nada.
Are you okay to share my slides, Tom? Or
yes, I am.
Nada?
Yeah,
Okay.
yeah, bear with me.
Thank you.
Screen one. There we go.
Well, good morning. And as Tom just said, my name is Nada Wakefield, and I am going to talk to you today not about the SPT, my subject, but I'm going to talk to you about something slightly different. So if we can have a next slide, please. So Sussex Digital InReach team, that is me and a few of my colleagues, and our aim is to support you as care providers across Sussex to deliver digital transformation so that you can realize full potential of technology with the ultimate aim of improving residents' lives. It is a completely free platform to you, and on this platform you can access advice, support on technology, digitalization, and of course my favorite subject, data protection. The Sussex Digital team is run by the care providers for the care providers, and it is overseen by the care associations, both in East Sussex and West Sussex, and that'd be the RCA and obviously West Sussex Partners in Care. So we can support you with a range of projects, and I have listed them here on the slides, and that is electronic care planning system or digital social care record, as you'll probably hear that term used a lot more. EMA, remote monitoring, that will be your falls prevention technologies, or auditory monitoring and things like that, data protection and security, of course, cybersecurity, digital skills, which will include your training, IT support, and any resources. But why is any of this important? So if you could have the next slide, please. It is important because in December 2021, government published a white paper. And in this white paper, it details plans to accelerate adoption of technology in adult social care. So what they want to happen is by 2024, for 80% of CQC registered adult social care providers to have access to digital social care record that is capable of interoperating with the local shared record. And in Sussex, this local shared record is called Plexus. Again, if you have a next slide, please. They also want to have 60% of care home providers to have access to digital social care record by the end of this year. So we are currently trying to work out the percentage of people who actually have digital social care record already. And you may be getting a phone call from either me or one of my colleagues asking you that one question. Do you have digital social care record? And if you do, what is it? By the way, if you are thinking of implementing digital social care record, have a look at digital social care website, and they have a list of approved providers. There are 7 of them. And why is that important? It's because these providers have the technical abilities to link with the shared record. Now, I'm pretty sure I don't need to tell you about the benefits of shared record. So you would be able to, obviously subject to consent, etc., access your GP records that the GPs hold on your residence. Also includes some acute settings and community settings. So you will be able to look at, for example, I don't know, blood test results, or it could be that the person has community physio, so you'll be able to look at what information the community physio holds on that person. They have already done a pilot in Bexhill. So 6 care homes were involved in the pilot, so they helped them digitize their records, and then they're trying to link them with Plexus so they can view their residents' records online. If we could have the next slide, please. So for all this to happen, we need to know really what is it that you as care home provider or care services providers want to know, want to have access to, and also what sort of things you don't mind sharing with other people. So if you want to have access to, I don't know, discharge letters, what is also hospitals may want to have some information that you hold about your residents. And because of that, Sussex Health and Care Partnership Aging Well programme are looking for care homes. It is only care homes on this occasion to talk to and work with, so they can get this this view from you, what it is that you want to have access to and what it is you don't mind sharing with others. They also want to know if any of this information is available already and who can access it. So if you are interested in this, do let me know and I'll put you in contact with the right person, or you can contact the right person yourself, and her name is Ailey Killick and her email is just there at the bottom of the slide. If we have a next slide, please. Also, to help you on your way to digitalization, we designed this little digital self-assessment. It's very short, it's only 5 minutes of your time, and it'll help you understand where you are in the terms of your digitalization. So you complete your assessment and you get a little score at the end, and it tells you, I don't know, 58% or 72% or whatever. So you know where you are. We're asking questions that, for example, about your infrastructure. So what is your Wi-Fi like, for example? Any equipment that you may have, any digital systems you already have, and really it's quite simple. It will take 5 minutes to complete. So apart from giving you that little information so you know where you are digitally and what you need to do to improve your score, it also gives us information of where the gaps are. And with that information, we can apply for funding and we can help you with bridging that gap. So that could be some training that we need to provide, or it could be maybe equipment or anything like that. So if you haven't completed your survey already, there's a link for your survey, or rather self-assessment. But if you have completed it, then just ignore this this slide. If we could have the next one, please. We are obviously here to help. You have heard from me a lot about your DSPT. One of the things that will happen, and that is quite imminently, is an organization called Orbis will be contacting you to arrange a site visit. So what they're going to do is check the digital infrastructure of your setting. And they're looking at things, again, like broadband connections, so what it is, how fast it is, how fast it needs to be to meet your needs. And quite importantly, they're looking at your Wi-Fi. So I know a lot of older Victorian buildings with thick walls and funny corridors, you have difficulties having good Wi-Fi in the whole building. So Orbis will be able to map this out and give you a little report at the end of it. And again, what we hope that at the end of the report, we'll be able to help you with some funding to put this right. You can find a lot of information about digital Sussex Digital InReach team on this little video, and I don't know if I have time to play it or not. And if we haven't, please do. It's just under 6 minutes long. But if we have got time, I don't know, Tom, you.
6 minutes sounds quite long.
Okay, don't worry. Then just as I say, you've got the link there, and you know, if you have got time, do listen to it. It's very informative, and it tells you all the. It is an amazing offer. I'm not saying it because I'm running it, but there is an awful lot of support for care providers, including funding, training, and a lot of advice on your digitalization. So you.
Can I just say it's really good if you do.
I was going to say, actually, yeah, go on, let's do it.
I think we should.
But also, Nada, whilst it's running, could you paste the links to the video, your email, and the survey in the chat, so then people can also copy those down and
yeah.
I've just put them in there.
Oh, you have, lovely. Thank you. Thank you, Hayley.
So, do I need to play, Nada?
Yes, please, because I can. Yes, please. I think you just click on it.
Oh, that's interesting. I've clicked it on a different screen. Bear with me. See if this is going to work. Okay, it's opening up on a different screen. I will just see if I can move the screen it's on onto your screen.
We can say.
Okay.
The sound's funny, Tom.
It's not working.
Okay. Now I remember this. There's a screen share. Share sound. Nice video clip. Share.
All care providers across Sussex to deliver digital transformation, realising the full potential of technology and ultimately improving people's lives at every level. The Sussex Digital InReach team provides a free platform on which care providers across Sussex can access free advice and support on technology, digitalisation and data protection. We are run by the care providers for the care providers, overseen by your care associations. All our materials, training and webinars are open to you and are completely free to use. Our team provides free advice and support on a range of digital projects, including electronic care planning, electronic medication administration records, remote monitoring, data security and protection toolkit, cybersecurity, digital skills such as training, IT support and resources. In December 2021, the government published a white paper which details plans to accelerate the adoption of technology in adult social care. The Digitising Social Care Records programme is aiming for all CQC registered adult social care providers to have access to a digital social care record that can interoperate with other NHS systems by 2024, which will play an important role in joining up services across the board. You will be able to access the information you need, for example blood test results, patient summaries, hospital discharge letters, and so on. However, the integrated care record is only provided to health and social care organisations that comply with the relevant laws about data protection. This is where the Data Security and Protection Toolkit, or DSPT, comes in. The Data Security and Protection Toolkit is an annual online self-assessment of your organisation's data and cybersecurity arrangements. Central and local government bodies and the Care Quality Commission recognise the toolkit as the official tool to evaluate your compliance with legal requirements. It also gives you access to NHS Mail. GP services now offer care homes access to several online services, including proxy medication ordering, which would save an average care home around 3 days of nursing time per month and approximately £5,000 annually. There are other benefits too, such as reduction in emails and phone calls, a better audit trail, improved clinical safety, improved stock control, electronic medication administration records, or EMAR. It is estimated that of the 237 million medication errors that occur every year in England, over 40% of errors occur in care homes. EMAR can reduce the number of errors, enable you to spot missed medications or signatures, monitor staff performances, and do a quick and easy audit on virtually anything to do with medications. As technologies evolve, so do the remote monitoring and telecare solutions. We are working with universities to design new technologies. The range of products already in the market is mind-boggling, and you can get anything from epilepsy monitors, fall detectors, environment monitors, personal well-being, and many others. With these tools and products, one member of staff could be doing all the monitoring and provide truly person-centered support, improving your residents' quality of life and at the same time saving you thousands of pounds. However, any digitally enabled system cannot be realised without a workforce that is skilled and confident in the use of technology. To help you with all of this, the Recover and Rise Digital Accelerator Programme have designed over 25 workshops covering areas such as improving your website, web security, marketing strategy, social media, and many others. Your website is your window to the world and can also help with your staff recruitment. Cybersecurity, ransom attacks, or data loss may seem like a threat a million miles away from a small care operator in Sussex, but all businesses can benefit from understanding cyber threats and online fraud. To help you, the National Cyber Security Centre has produced an e-learning training package. It is free and takes less than 30 minutes to complete. With the increased use of technology in care settings, it's vital for you and your staff to have basic IT skills to help you manage your everyday tasks. We understand that you may not be IT experts, and that is why we have a team to support you with your IT needs. Our IT support will be able to offer free remote advice and run free short monthly online courses on a range of IT subjects.
Why not check your level of digital readiness by completing the free 5-minute self-assessment that you will find on our website.
So this is your Sussex Digital InReach team, your one-stop shop for all things digital.
So if anybody has any questions or anybody has any need for training on digital subjects, do let me know and we'll try and arrange that for you.
Shall I stop the screen sharing now?
Yes,
Nada?
please. Yes, that's finished. Yeah, that's me done.
Brilliant, thank you. So I'm hoping that the technology worked there. It's hard to tell. Always works at my end because it's on my PC, so I don't know if it's working or not at your end.
It worked.
Brilliant. So that's reassuring to know.
Can I thank Nada because she's taken this on to a new level that we never really anticipated. And I'm just so grateful. And she actually created that video, which I think is quite amazing, really, and puts it in layman's terms that even I can work out and understand. It's got to be a club.
I don't know if anybody's interested, but I was thinking that maybe you could have your residence guide read like this for people who are visually impaired. So if anybody's interested, I can find out. It'll tick the box for CQC about your information accessibility.
Mm.
Well, that's a good idea. It's a very good idea, and another
Yeah.
good use of tech.
Yeah.
Has anybody any questions? Because there's quite a lot of useful information in there, so yeah, anybody want to just unmute and ask any questions?
We are sending it out to all care providers across Sussex, Tom.
Yeah.
But today it will be in newsletters and regularly circulated.
I had several questions, but I wrote such a jumbled heap of stuff that I can't quite pick them out now. You mentioned Orbis, Nada. Is there any charge for that?
No, there's no charge. So it is completely free. So what we're hoping to do, they'll be coming along. They'll be making obviously phone calls to arrange the time. They'll be doing their mapping out. It's all quite technical, so you may not know the answers, but I've been assured that they're able to tell all that by just looking at at things, wiring presumably, and I know they could get internet speed, etc. So they'll do all that for free, and they'll give you a little report for free. After that, obviously, you can decide whether you want to make an investment. But what we're hoping is that the second stage of the project is for us to be able to access some funding to help you along the way.
Brilliant. Okay, thank you. And then going back to the shared records.
Yes.
I know they're available to us in our care home because we use Nourish for our digital care planning. Are they available for Dom Care clients as well?
Not at the moment, as far as I'm aware.
Okay.
As far as I'm aware, they're only working on care homes now, but
Okay.
it will go on to Dom Care as well
in the future. Okay. And my last point really is a point rather than a question, which is for people who haven't yet signed up to a Dom Care, to a digital care provider. Just one of the things that I think is really important to know about before you join a provider is what happens if you decide to leave them. It's a bit of a negative point, but actually in our Dom Care, we're using a provider that I'm not particularly happy with, but we've been using them for about 8 years. And I can't actually see how we can leave them because they've got so much data, and the day we stop paying our enormously expensive monthly fee to them, we will lose access to all of that data. And they make comments like, well, you can just download it all in PDFs, but that's just not viable.
Yeah.
And I think as a comment to pass on to you, Nada, I think that those who are on the NHSX list should be, one of the criteria should be that they actually give you a reasonable exit strategy, because you should be able to change providers. You shouldn't just be stuck with that provider for life.
You should, and that is definitely one of the questions you should be asking when you sign up. And if you look on our website, it does have a little section on digital social care record, and that is one of the bits of advice that check your exit strategy. But I will put this on my list to
Thank you.
Pass it on. Exit strategy.
And again, I have no vested interest in Nourish whatsoever, but we do use them for our care home, and I think they're really good. And the other 6 on the list, I've not used any of those. So the one we're using in our Dom Care that I really don't like is not on the NHSX list. so that's probably a good thing, but certainly Nourish are very good. And that's all my points. Anything from anybody else on that? Okay. Then it's over to, thank you very much, Nada.
Thank you.
I completely agree with Rosemary about the brilliant work you've been doing. You're making a real difference. Thank you. And over to Rosemary for WSPiC updates.
Have we not got Hayley's on the recruitment hub first, or is that part of
well, it's part of, so I can,
yeah.
Okay, over to Hayley for the recruitment hub. Do you want to share that slide, Hayley?
If that's okay, yes, please.
Have you got?
Thank you. Yeah, it's just one short slide, just to say hi and thank you. And I'm really excited to tell you about the recruitment support that we've been working on over the last few months. So it has officially gone live on our website, and it was really it was born from conversations with you, conversations with our borders providers, surveys, questionnaires, things that we sent out. So it really helps us to highlight the challenges that you're all facing at the moment, so that we can tailor what support we can offer as a care association. It is building on things that we learnt from you from the conversations about recruitment that we held last year, and the brilliant thinking differently about recruitment and retention that we held with the CABS team and Skills for Care and Neil Eastwood, which was really, really good. And so what we were hearing and what we want to do is that you need to save time. You don't have a lot of time. As managers, you've got so many different hats that you wear, and recruitment is obviously one of them. And that you need some easy access to relevant resources. So something that we realised is that there is so much out there, so much support with recruitment, so many resources, and to sit and go through and find the ones that are going to be relevant for you takes time. So we thought that's maybe where we could help. So one of the things that we can do, if you come to us with a particular problem, we've developed a huge menu of support, resources, events that are going on around West Sussex to do with recruitment, including Skills for Care. They do lots of training on improving your recruitment. They use TikTok, Facebook, Twitter, and they do individual sessions, which is really brilliant. And obviously everything that we've heard today, So Proud to Care, do amazing amounts of work. And rewriting job adverts was one of them that was just brilliant, that Rosemary and I didn't know about, which was great when we met with Taz. So that was something we didn't want to reinvent the wheel. We didn't want to add another thing for you to look at when you're looking at recruitment. We actually just wanted to gather up what is already out there that we can help signpost you to. So if you've got a problem with your retention, we've got a list of things that we can send you, offer you, help you out with on that. Lots of different things. And then the other sort of arm to the recruitment support that we're offering, we've built up some really good relationships with the colleges and universities in West Sussex. So particularly Worthing, the Met College, University of Chichester, so that we can help post your adverts across their systems. And so we know, as Karen Stevens says quite a lot, there's a churn of care workers that work in different services, and something that we need to look at, that we know we need to look at, is to recruit new people into care. And somewhere really good to start with that are the colleges. I know from myself, I went to college and did health and social care with not really a good idea of what I wanted to do. Karen's just arrived. So if we can, get those kinds of people that have a slight interest in social care but not really sure, and we can advertise your jobs to them, then hopefully that will encourage them into the sector and help to grow the workforce, really. So you can go to our website, and I'll pop it in the chat, and you can send us your advert. Let us know where you want it to be posted, including the Made with Care website, universities, colleges, and we can do that for you. So you can reach multiple people with just one form. And I know Rosemary's going to talk a little bit about her, but we've employed a fabulous admin assistant called Kirsty. You might have had a couple of her emails already. She's just brilliant. I'm really, really pleased that we found her when we did. And she's the one that's going to be helping with all those kinds of things. I think that just about sums it up. But it is basically, in essence, we've gathered all the different resources, all the different things that are out there to hopefully help signpost you to them, and maybe help find things that you didn't realise were out there. So yeah, that is me. Hopefully I covered everything. Do you think?
Thank you.
I think so, but I just think people need to know it's like a one-stop shop. When you have a vacancy, if you get your advert out, then Hayley and Kirsty will do all the load of work, making sure it's sent out to as many different places and platforms, etc., as possible. So we are, as the association, desperately trying to help you with this problem. We know it's not a local problem, we know it's not a Sussex problem, but it's a national problem. And we are up against places like the Co-op, who are giving 17-year-olds £9.90 an hour plus enhancements at weekend. And how we try and crack this, I really, really don't know. I think we do have to try and raise the value of what we're doing that has been totally flattened by the pandemic. And yesterday's ruling probably has supported us in a way, but what happened in those 2 years has done fundamental damage, put back the role of social care years, and how we're going to try and rebuild on from that, I really don't know. So if anybody's got any wonderful ideas about how we put back the value and the amazing work that our staff do, I'll be really, really grateful. But it's going to take time, I think. So Hayley,
I
that
think
was
Nada, if you put your hand up.
I have. I'm not sure if this is, I thought it was extremely helpful. I listened to a webinar. It's done by Skills for Care, and it's a masterclass on using social media for recruitment. The next one, it was Facebook. You can look at it, you can look at the recording. I thought it was brilliant. It just explains how the algorithms work and what you have to put in to attract people or not attract people. The next one is on the 3rd of May, and it's a masterclass using Instagram to boost your recruitment. So I will put it in chat. Obviously, you need to book it. It's on Eventbrite.
Thanks. And something else just to add to that as well, where we're collecting events and things, when Kirsty will be sending out lots of emails about it, not overwhelming your inboxes, but things like events that are coming up will be included in that, just to make you aware of things that are going on. Yeah, so that will be part of it, very much so.
And moving on, another really exciting thing that I think we're doing for care providers with the wonderful Hayley and Kirsty is our new training hub, working in close partnership with West Sussex. Do you want to describe a little bit about where we're up on our training hub, Hayley?
Yeah, we've in the early conversations. Again, there's lots of conversations about training going around, lots of surveys, trying to gather information on what you guys need, including, I think Karen will probably talk about it later on as well. And we've sent out a survey. So it's at the moment we're in an early stage of sort of scoping what we can do to help you as a care association with your training.
And there'll be more information on this hopefully going forward and we as a care association are thinking about maybe being offering training via private providers at reduced rates for members, with some of the training that we know that we're behind on, that we haven't been able to do face-to-face, that we could get caught out on with CQC in specific regard to moving and positioning, maybe first aid, all the things that we've struggled with over the last 2 years. And we're desperately trying to see if we can plug that gap in some way that is affordable and accessible. We're very lucky to have an offer with Helen of a training room with moving it, positioning equipment that we would be able to use. So we've got some ideas going forward to support you in that. I haven't got the list of things that I should have been, because I didn't prepare it. The other really good project, that of course, is the SCARF, which is supporting registered managers in Sussex going forward. I wouldn't like to say it's post-COVID because we're still very much in COVID, but it's rebuilding on from the last 2 years. And we've relaunched it a little bit, and there has been a much greater interest. We've had 41 new referrals since March, bringing us a total of 111 referrals in total. The masterclasses that are being provided at Roffey Institute are proving really successful. And we've had the first masterclass, we had 21 sign-ups. The second one in May, we've had a total of 25 sign-ups. So that has been really, really good. We've got the mentoring hubs that I think took a bit of a dive, but now they're being reinvented. And that's showing much more interest. We're also looking at coaching and mentoring. We've obviously identified that most registered managers don't get the opportunity for their own supervision because we work in isolation and autonomy. So we're looking at one-to-one support with coaches and mentoring. And there is a coaching and mentoring offer from the Sussex Health and Care Partnership, which is 3 days remote foundation course that will be available not only for you to coach and mentor your staff, but going forward, coach and mentor other care providers. And that will be leading on to a level 3. We have got so the coaching program, the masterclass program, the hubs, and we have got on the 1st of July, away day at Halstead Place as a one-off discussion, celebration, time to catch up and identify where we're all feeling and what our next steps are. Karen, Sophie, is there anything you want to add into that?
I would just say take a look at the website. So
For the new website.
Juliet, yeah, the website's new. It looks fantastic. There's some great bits to just explore on there, some great opportunities. And one of the things that I think is nice, having been so intense with COVID, and again, I'm not saying that's gone away, but it's just nice to get your brain thinking about other things and some great opportunities out there. So yeah, take a look at the website, have a little dive round.
Yeah, well said, Sophie.
And then the other thing we were looking at, and it may be something that you think will be useful, we talked about, we've got the policies on our members' website, but we were talking about resources, things like templates for appraisal, supervision, disciplinaries maybe, and I don't know if any of you would think that that was a good idea, or any of you would want us to take that forward, but if you do, that's something else we're contemplating. Membership, Hayley, is now on the website, easy to apply, and hopefully you'll all be rejoining. And those who haven't, let's hope you do. So anything you want to say on membership, Hayley?
I think you've summed it up really nicely. It's on the website now, and there's just a simple form with payment details at the bottom, and we would love for you to join or renew. And yeah, you should hopefully be getting my emails anyway. If you don't, then give me a shout in the chat and I'll make sure you do.
Rosemary, I'm slightly conscious of time.
Okay, I was just going to say we met with Keith, the DAS who's leaving, and Alan Sinclair, who's coming in, and he seems very keen to work with us on all the things that are, you know, in this very challenging time. And I think we've already got our next meeting planned for June, and that is about the cost of care, the care levy, and exciting things like that. And I think I'm not wanting to say it's all down to us, but I think we should acknowledge that we got a far higher rate of care fee increase this year than most other local authorities put together, really. So I think there's an acknowledgement of that as well. So, okay, I'm going to pass you over to Karen.
Thank you. Am I able to share, Hayley, or did you prefer?
You should be able to if you want.
Okay. Yeah, lovely. Hopefully you're seeing my slides.
Mm-hmm.
Yeah.
Lovely. Thank you. Sorry, I haven't been here full time. In fact, I've been at a meeting looking at how we can better support recruitment into health and social care across the patch. And also we'd had quite a detailed conversation about international recruitment, because I know people are considering that as options, but of course sometimes it comes with additional strains on you as an employer about how you attract, recruit and develop people internationally as well. But there'll be more information coming out about that. The things I wanted to emphasize, just make sure these slides are available for you. We're all the time asking you to consider getting your data on the adult social care workforce data set, used to be called the NMDS. That's an overview of some of the additional benefits, as well as, of course, the Workforce Development Fund that's available if you're also present on that data set. We are in the process at the moment of asking for partners to come to manage the Workforce Data Fund. So we're tendering out as we speak how we can get that Workforce Data Fund out to you, but being a part of the data set is important. And, you know, I'd quite like a conversation at some point about how we can enable people to do that, to be on that data set, what would be useful, etc. Because it can feel onerous sometimes to get your workforce data on there. Via that link at the top there, you'll see that we're putting together a lot more resources around good and outstanding care. There's a specific website section to help you with CQC requirements if you're a new service and you're setting up that activity, preparing for inspection, lots of toolkits, improving your rating. And then there are virtual as well as templates that you talked about and checklists to help you with that. So we've really started to collate information around that. Thank you, Nada, for the pitch on the webinars. There are those webinars about enhancing your recruitment approaches, but we're also all the time looking at actually, perhaps if you're a new manager, do you need to have a bit of an overview about how Skills for Care can help you? There's an example of a webinar we're putting together on that as well. Because when you're looking at your workforce support and getting your head around the offer from Skills for Care, it's a way of us saying this is what's around and about for you. And what we do is we email every new manager. And then as locality managers, I'm also put in touch with them if they request that. And so it's a way that I can, for example, weave in the scarf offer on wellbeing, as well as signpost to your own website on the West Sussex Partners in Care as well. Hayley hinted at this. We're doing a couple of 3 in all actually dates, the repetitive dates, they repeat the exactly the same content for people to come and have a natter about, let's talk some training. There's a lot of projects currently that are saying, we're there to develop your clinical skills, we're there to develop your leadership skills, we're there to offer you training. And we thought it was an opportunity really to get people together to talk about what would be useful, what people find difficult to access, what Rosemary said about the catch-up phase we're in. It's all online. Let's now see how we can move to other opportunities. And there's the dates and there's who to email. I'll be at all of those dates. And so people are very welcome to come along to one of those and talk training and what would be useful. And part of the other focus we're looking at is trainee nursing associates. It's the relatively new role. They're an NMC recognised role and Nursing Midwifery Council recognised role, but we have enhanced funding and resource to help you think about actually, how could a nursing associate fit into my skills and my staff and my service? And we do have people who've got very live examples of where it's really helped with their nurse recruitment. They've re-looked at their staffing and said, with a trainee nursing associate and a nurse, perhaps we can see how we can develop our approaches to recruitment. We're offering some drop-in sessions. They're just question and answers, and I can get you a lot of information about if you're thinking about nursing associates and the role they play in your staff group. And I've kept it really short. But if there's anything you want to contact me about, what are you doing about recruitment? What are you doing about skills? What about careers? Anything you want to ask of me around that, I'm very happy to have any contact from you. And just to say, I appreciate what Hayley and others are doing about getting those messages out around as well. Because it's a really busy time, isn't it, in terms of what we need to think about, that enhancing our training, our careers, our recruitment activity. It's a really pushed time in terms of getting the right staff with the right skills. So there's my details if you want to get in touch around anything I've said, or anything you want to challenge me about in terms of what's going on. Very happy to be in contact with you. So I'll stop sharing there. And Hayley's got those slides to send out, and very interested if people want to talk training on those talk training sessions as well. Welcome any questions or?
Brilliant, thank you, Karen. As always, a really informative and rapid run through of all the fantastic facilities that Skills for Care offer to us, and the great support that's available. Nobody seems to be either raising a hand or switching off a mic. We're pretty much there at the end. I have got I was at a meeting yesterday where they were talking about the current coronavirus levels, which I could show a couple of quick slides from if people were interested. But if not, essentially, I mean, in a nutshell, as you might all expect, a couple of weeks ago, the levels were actually as high as they've ever been. But testing was, positive test results were quite low because nobody's testing anymore. Well, everybody in social care is still testing, but the rest of the population pretty much isn't. But thankfully, death rates are still very, well, they're normal, essentially. So there is still some coronavirus being mentioned on death certificates, but the actual death rates are no higher now than they normally are, which is a great relief. And levels are now dropping compared to what they were a couple of weeks ago, but 2 weeks ago, I think they were at their highest ever. And they're obviously basing that now on extrapolated data from groups of people who are tied into testing rather than national figures, because we don't actually have any national figures anymore. So the last thing for me to do is to say thank you to all the speakers today, and for Hayley for putting everything together. It's been obviously a focus on recruitment today, and I think a really helpful session. Loads of really useful resources. That was the word I was looking for. I was talking about Skills for Care, Karen. Lots of brilliant resources, and throughout the morning, lots of brilliant resources. And the last thing is to say, if you can use this resource, you need to do it whilst we're talking, to actually get out your phone and just scan or just open your camera up on that QR code, which will give you the opportunity just to give feedback via Umbrella Insight. And that will give you all an insight into how it works. Am I hearing Neil's voice?
I am here. Can you hear me okay?
Yes, we can, yeah.
Great, yeah. It's that simple. Just scan the QR code and you'll find, and you'll be able to use the service firsthand to see how easy it is. And you'll be able to fill out the feedback, which is essential for all businesses, including WSPiC Partners in Care, to understand, whether you're hitting the right notes, whether they're supporting you. So they want to know. So do take the time to fill it in.
Okay, so I'm going to leave it on the screen and just zap it with my phone while it's there. Check it's working for you, Neil. Yeah. Oh.
If there was one good thing that came out of COVID, it's the fact people know what QR codes are nowadays.
Certainly do. Yeah, it's worked on mine. I've got it there. So unfortunately, because I've got video sharing, I'm actually going to stop sharing just for a second, and then I'm going to reshare my screen, but without video clip.
So it's clearer. It did work for me.
Yeah, but I was losing the video of the
I can see Rosemary's got it.
Yeah. So I don't know whether there's if anybody's struggling with that wants to do it but hasn't done it, then speak up now. Otherwise, thank you all, and
Tom, can I just say that next time we're hoping to do it face to face in the real in July.
Absolutely.
but we don't know whether or not it's going to be at the rugby club, which is very accessible in parking, but we haven't got many breakout rooms. But whether or not, we'll probably do a little survey or something saying where would you like it to be, but it's going to be somewhere that's accessible for everywhere.
Somewhere that we can have coffee and cake together.
Indeed, and parking.
And parking. Tesco then.
Well, I recommend Uvages up here, actually.
Okay. Right. So hopefully you've all got the QR code, and thank you all very much for your participation, and see you all soon.
Thank you.
Thank you.
Thanks all.
Bye-bye.
Bye.
Bye.